Everyone, it's Malam Manav, an ongoing physiotherapist. Today we're gonna discuss on a topic like indication for pulmonary function test. Before moving towards this topic, we should have just basic idea about what is PFT, pulmonary function test. Let me give you a brief about this. Pulmonary function test is a test which is performed to evaluate the normal function of respiratory system by a non-invasive process. So non-invasive process means the process in which you will not puncture your skin. So basically this is pulmonary function test. So I gave you the brief about this test. Now we will move to our main topic, indication for pulmonary function test. So first indication which will be included in the indication is medical diagnosis. So there are many respiratory complications like COPD, which is an obstructive disease, and restrictive diseases like pneumothorax, then hemothorax, then hydrothorax, and many other respiratory disorders which can be evaluated by this pulmonary function test. So let me mention some here in medical diagnosis like COPD, one of the obstructive disease disorder. Then we can include from restrictive, we will take two like hydrothorax and pneumothorax. This was the first indication. And the second indication is difference. The second indication is the differential diagnosis between restrictive and obstructive disorder. This is the one of the, I think we can include this one of the major indication among this, because it is very difficult to differentiate the restrictive and obstructive disorders. It will help to differentiate it. So second, why we included this indication, this is the reason. The third would be public health and researches. Let me tell you, public health and research is how connected with indication. So we are seeing people are having different kind of volume and capacities of lungs. Like let me give you an example of a common people and an athlete. You can do a research on this kind of things, like on a common what would be the volume and the capacity of a normal individual, and what would be the volume and the capacity of the athlete. So it can be also used in research, study, or public health things. Okay, so this would be the third indication, and the last for surgery evaluation. The fourth indication is surgery evaluation. With the help of PFT, you can see the normal function of lungs and everything. You can test everything. So if there would be any kind of failure or dysfunction of the lungs, you can evaluate that there will be a lung failure. So you can go for lung transplant. So this thing is included in indication. So that was all. Thank you.